Hi, we're here at ISTH 2022, and this morning I have the pleasure of speaking with Dr. Geoff Barnes from the University of Michigan.
Thank you for having me. This is great.
It's great to have you here. How are you doing this morning?
Wonderful. It's been a wonderful meeting. I'm sad to see it come to an end, but I've learned a lot. I've connected with colleagues, so it's really been a wonderful time.
Yeah, it's nice to finally see everybody in person again.
Absolutely.
What have been some of the more practice-changing trials or information presented that you think you're going to take back with you?
Well, there's one in particular that's sticking out. A colleague of mine, Dr. Paul Dobish, presented some observational data on the approaches people have taken to bleeding related to different anticoagulants, many for the DOACs, but also including patients who were using low molecular weight heparin. It was a really large cohort of almost 2,000 patients, roughly half and half treated with 4-factor PCC and the other half with andexanet alpha. And he presented some very intriguing data about the outcomes of that study and maybe a little bit of a prelude into what we might see in a randomized trial.
Yeah, I saw that. I thought some of the outcomes were very thought-provoking and potentially will change the way hospitals are going to have to approach their formulary and think about cost and drug use and effectiveness of one therapy versus another.
I agree. And it's one of the things I love about these meetings is you get this sort of this introduction to the data and you see some really interesting things, but then you always want to see more, right? Well, what about in the subgroup of patients with intracranial hemorrhage? Or what about just in the patients treated with low molecular weight heparin? And so I'm really excited to see what the peer-reviewed manuscript will show so we can dig into the data and really learn.
Exactly, because you're totally right. There might be a completely different way of approaching an intracranial hemorrhage versus a GI bleed, which can be more supportive care measures and maybe not needing to go straight to indexa in those issues or areas unless the patient's overtly bleeding and can't stop. So
Absolutely, yeah.
I think there's been a lot of great data coming out, a lot of great guidelines. You've also had some posters and presentations here. I know that we've talked a lot about deprescribing aspirin in the past, and there was actually the poster presented here for looking at mechanical valves, which I thought was interesting, if you want to speak a little bit about that.
Yep, so there was some data looking at mechanical valves and whether or not we should be deprescribing aspirin if the patient's already on warfarin and some of the safety there. We actually have an oral presentation coming up today. It's one of the last presentations.
That's why I stayed.
Excellent. It's looking at sort of what happens when you combine aspirin with each of the different oral anticoagulants, warfarin, apixaban, and rivaroxaban. It's the three most commonly used in the States. And I'm really excited to present that data. One of my colleagues, Dr. Jordan Schaefer, is going to present that. And we have a manuscript ready for submission. So hopefully that'll be out in the coming months.
Oh, that's excellent. I think another important issue that's come out of this conference too is all the women's health talks. I was really impressed to see them step it up and put in a lot to get people more in line and in mind with the different issues that women face when they do get put on anticoagulants at a young age or when they have to stop their hormone therapy. So I think hopefully that's something too we can all take back to our practice sites and be more mindful of when talking to our patients.
I agree, and it's one of the things that I always enjoy about the ISTH Congress is that everyone's focused on thrombosis and hemostasis, but they also have these subgroups of different areas. So people who are interested in, cancer-associated thrombosis, and there's an entire group focused just on women's health and thrombosis and anticoagulation, and they really present some of the best science there. And we're going to see some at a late breaking here in just a few minutes, the high-low study looking at different levels of low molecular weight heparin prophylaxis for pregnant women.
Yeah, it's really exciting.